Once you decide to have a tummy tuck, we want to provide the best possible experience for you. That's why we'd like to tell you about an advanced technology that transforms your tummy tuck recovery. One of the most common problems after a tummy tuck is fluid accumulation. Fluid is part of the natural healing process, but too much fluid can push apart the tissue layers and slow down healing. There are two ways to manage fluid accumulation during recovery: through the use of post-operative drains or a new drain-free option. Historically, drains have been part of the tummy tuck experience. They're flexible, clear plastic tubes that end in a bulb that collects fluid. They are placed under your skin to route the fluid outside of your body. Depending on your procedural plan, drains may be in place for up to 3 weeks. Many patients find drains uncomfortable and painful during recovery. They must be pinned to binders or undergarments, which makes it awkward and cumbersome to hide under clothing. They can be messy and leak onto your clothes, especially during your required drain maintenance. A lot of people also don't like that they have to empty and measure fluid multiple times a day. Drains may also interfere with sleep, as they may tug on stabilizing sutures, causing pain and discomfort. Drains also need to be removed by a healthcare professional. Drains can cause infection and additional scarring, and removal can sometimes be painful. However, your doctor now offers a revolutionary new option that may allow you to recover drain-free. TissuGlu is the first and only FDA-approved synthetic surgical adhesive for internal use. TissuGlu is a clinically proven alternative to drains for your tummy tuck. TissuGlu is precisely applied with a special applicator. It forms a strong bond between tissue layers to help you heal naturally, without drains. TissuGlu reduces spaces between the layers where fluid can collect, allowing your body to resorb fluid as part of the healing process. TissuGlu safely breaks down and is eliminated naturally from your body. In clinical studies, those who were treated with TissuGlu were able to get back to daily activities like showering, driving, and returning to work sooner than those with drains. Regardless of which option you choose, some people will still require additional fluid management. However, a clinical study showed that 3 out of 4 patients who had TissuGlu required no further treatment. TissuGlu frees you from anxiety about the care and maintenance related to drains. Here's what a TissuGlu patient had to say about her tummy tuck recovery.
Not having the drains definitely impacted my decision because I felt a lot less anxiety about the procedure and about the recovery time. And I also felt like not having drains was less of a burden on my husband taking care of me after the surgery and having to handle that.
Ask your doctor if a tummy tuck with TissuGlu is the right experience for you. Important TissuGlu surgical adhesive safety information. Indication: TissuGlu surgical adhesive is indicated for the approximation of tissue layers where subcutaneous dead space exists between the tissue planes in abdominoplasty. Contraindications: do not use in patients with known or suspected allergies to urethane-based or isocyanate-containing products. Warnings: do not use TissuGlu surgical adhesive in patients who have had prior exposure to TissuGlu. Immunological response associated with repeat TissuGlu exposure has not been studied. The effectiveness for the treatment of patients with BMI greater than 28 has not been established. Higher BMI patients have a propensity for fluid accumulation and may have an increased risk of seroma formation. Effectiveness was not observed in weight loss patients undergoing abdominoplasty. Weight loss patients have a propensity for fluid accumulation and may have an increased risk of seroma formation and aspiration. Benefits: TissuGlu may reduce the need for drains after surgery. By using TissuGlu instead of drains, you may return to normal activities more quickly, experience less discomfort and pain than when drains are used, have fewer invasive treatments for fluid management. The results showed that 73% of TissuGlu patients had no treatments after surgery. However, some patients did require additional invasive treatments, including reinsertion of drains. Risks. Clinical studies were performed using TissuGlu. There were no increased safety risks with the use of TissuGlu than when drains were used. Potential complications associated with the use of the device and the tummy tuck procedures include seroma fluid formation. These complications may require treatments such as drain placement and/or fluid removal by needle, which may be performed in the operating room. Additional potential complications include wound healing issues, rash, redness, surgical site or incision infection, scarring, hematoma, bruise or swelling, incision separation, and immunological reaction. Safety information. For full safety information, please visit TissuGlu.com, contact your doctor, or call Cohera Customer Support at 1-800-641-7458.